and welcome to the Solent NHS Trust Cardiac Rehabilitation Programme. My name is Megan and I'm a cardiac rehabilitation instructor. Along with my colleagues in the team, I'll be helping guide you through your recovery from your cardiac event or surgery over the coming months. Even though we can't meet you personally at the moment, you'll be getting regular support and advice from us. This will be either directly by phone or via the Activate Your Heart programme online. This will depend on what our team of clinicians discuss with you at your initial assessment. Safety comes first in our service, so please make sure you pay attention to the following safety information. Before you do our exercise programme, please make sure you've taken your medication as you normally would on any other day. Also make sure you haven't just eaten a big meal and you've left 2 hours after eating. Make sure you're not currently on any antibiotics. And make sure you feel your heart condition is stable and you've not had any new symptoms in the past week. Also, if you're a diabetic, make sure your blood sugars are well controlled. Never attempt the exercise if you have any chest pain at rest, or if you have a temperature or are generally feeling unwell. Also, it's important not to exercise if you've got a heartbeat that feels irregular and that's not normal for you. To do the exercise effectively, you should try and wear loose, comfortable clothing. Be in a room with enough space to take a few steps in either direction. You might need to open a window for airflow, and also have a glass of water nearby and take regular sips throughout the exercise session. The exercise programme is structured in a way that's safest for you. Every level has a 15-minute warm-up, a conditioning or cardiovascular section, and then a 10-minute cool-down at the end. The warm-up is always 15 minutes long. This is to make sure your body's prepared for the exercise. It's the gradual increase in effort which will improve the blood flow to your heart and your working muscles, and the stretches will help improve your range of motion. The conditioning section of the session will help increase the strength and tone in your muscles and also, importantly, the efficiency of your heart. Over time, this is the section where you'll be able to work harder and faster as your body becomes fitter and stronger. You can start by just doing 5 minutes or more of the section, aiming to increase it over time. We'll give you a choice of up to 30 minutes of work, but you can skip to the cool-down section at any time. The cool-down. This is the part of the session where we bring your heart rate and blood pressures back down to normal levels, as both will have risen during the exercise. It's really important to do this gradually so you can help prevent dizziness. During the session, you should print and display the Borg scale we've emailed to you and review how to use it. This is so you can assess how hard you're working in the session. When you do exercise, a normal response will vary from person to person, but you'll probably feel very slightly sweaty. You might get warm or feel slightly flushed. Your breathing will be deeper and faster, but you could still hold a conversation with someone. Also, your heart rate will quicken. Indications you need to slow down and make less effort during the exercise include that you feel very tired and are sweating more than usual, or your breathing becomes really uncomfortable. Your Borg scale is higher than a 14 or 15. And if your Borg doesn't reduce when you've slowed down, just slowly walk on the spot. If you're still having problems after a couple of minutes, stop and sit down. Indications you should stop exercise and sit down straight away is if you have chest pain, or if you feel dizzy, or if your heartbeat becomes unusually irregular. These are abnormal responses to exercise and could be due to overexertion. You should discuss any of these responses with your cardiac rehab team before you attempt to exercise at this level again, and see our chest pain protocol if you've had chest pain. Please remember you can call your cardiac rehab team on our non-urgent phone line 0300 123 3793 if you have any questions or concerns that we haven't already answered.